Okay guys, let's proceed now with purpose and principle of haemoglobin cyanide method. As I told you, that is one among of the method that we are using to determine or to estimate the hemoglobin concentration. So let's begin with purpose. Now, hemoglobin estimation is performed to screen for the anemia and determine the level of anemia, and also to monitor the treatment of anemia. So that is the aim and that is the purpose of hemoglobin estimation or doing hemoglobin estimation. So the purpose of hemoglobin cyanide method as the method of doing hemoglobin estimation is performed to screen anemia. It means that to know the anemia condition, and also to determine the level of anemia, with the level of anemia to an individual, is it severe or is it mild. Also to monitor the treatment of anemia. If someone now has the condition of anemia, now he or she will going to be treated with different maybe medication. So after that, also we just want to do the monitoring or follow-up of that treatment of anemia. So also doing the hemoglobin estimation or hemoglobin concentration, or to determine the hemoglobin concentration, mean that it aids us to know or to make follow-up or to monitor the treatment of anemia. So that is the purpose of doing hemoglobin estimation. So that is also the purpose of doing hemoglobin cyanide method as the method of doing hemoglobin estimation. So now let us see the principle now of hemoglobin cyanide method. So the principle, it says that hemoglobin is converted into stable hemoglobin cyanide pigment using Drabkin solution. So Drabkin solution, that is the solution that contains the cyanide molecules inside. Drabkin solution is the solution that contains cyanide pigment. So when you take that cyanide pigment, or when you take that solution, Drabkin solution, and then you combine and then you mix with hemoglobin, is going to form hemoglobin cyanide. It's going to form what? Hemoglobin cyanide, or it's going to be converted to the stable hemoglobin cyanide pigment. So when you take the Drabkin solution and then you mix with the solution of blood, or you mix with blood, it means you are going to convert that hemoglobin pigment that will going to combine with that cyanide pigment inside the Drabkin solution, and then finally to form the hemoglobin cyanide pigment. So that Drabkin solution, that is the solution that contains cyanide molecules. That solution is contained the potassium cyanide. So that potassium cyanide combined with hemoglobin inside of the blood, and then convert that hemoglobin to the stable hemoglobin cyanide pigment. So the intensity of this solution, the intensity of the color of that pigment in that solution is directly proportional to the concentration of hemoglobin in the blood samples. So when you take that solution of a combination of hemoglobin and cyanide pigment, which is finally form the hemoglobin cyanide pigment by using the Drabkin solution. So that solution, the intensity of that solution, the intensity of color of that solution is directly proportional to the concentration of hemoglobin inside our blood sample. So when we measure the intensity, when we measure the optical density or the absorbance of that solution. And when we take that absorbance, or when we take that optical density of that solution, that optical density will going to be direct proportional to the concentration of hemoglobin of the sample or of the blood sample. So that is the principle behind, or that is the mechanism behind. So hemoglobin is just converted into stable hemoglobin cyanide pigment by using Drabkin solution, a solution which contains potassium cyanide. So potassium cyanide combined with hemoglobin pigment to form the stable hemoglobin cyanide pigment. So the intensity of color of that pigment, the final pigment, which is hemoglobin cyanide pigment, so the concentration or the optical density or the intensity of that pigment is directly proportional to the concentration of hemoglobin inside our blood samples. So that is the principle behind. So now, after looking the principle and purpose of that method known as hemoglobin cyanide method, so now let us see the reagent and material and also equipment and type of sample or blood sample which we're going to use in order to perform this method of hemoglobin estimation known as hemoglobin cyanide method. So we have the reagent and material as well as equipment and type of blood samples ambayo tunaweza tukaitumia. So let's begin with reagent. In the reagent, first we have Drabkin solution which contain potassium cyanide and potassium ferricyanide, also sodium bicarbonate and distilled water. So that is the ingredient of Drabkin solution. So Drabkin solution inside is contain potassium cyanide, potassium ferricyanide, sodium bicarbonate and distilled water. So that is the ingredient of Drabkin solution. Also we have standard hemoglobin solution, standard hemoglobin cyanide solution, which is act as a control or as a simple control. So we have standard hemoglobin solution, which is sometimes is known as control. So in the reagent we have Drabkin solution, and also we have control, which is standard hemoglobin solution, the solution which contains the known amount, known level of hemoglobin concentration. Also we have materials. In materials we have conical flask, we have gauze, we have filter paper, we have brown reagent bottle which stock Drabkin solution. So brown reagent bottle which is used to store stock Drabkin solution. So that is also the material. Also we have test tube. We have 5 mils pipette, we have 20 microliter pipette for the purpose of aspirate or sucking the fluid. Also we have the test tube break, we have cuvette, we have disposal bucket, or you can say the waste containers, because finally when you finish to perform that method, you have to dispose your waste. So you are going to dispose to the waste container or disposable bucket. Also we have pipette sucking bulb, and lastly we have rubber cork or parafilms. So that is the materials. So now let us see the equipment. In equipment we have calorimeter. So that is the equipment that we are using to do this method known as hemoglobin cyanide method. So we're just using calorimeter, and actually calorimeter, that is an equipment that is used to measure the optical density or absorbance of the certain fluid. Also we have type of the sample. Type of the sample, we have the whole blood, we have capillary blood. Capillary blood actually is a whole blood. So we have whole blood, from the capillary, and also we have whole blood from the vein, or we can say venous blood. And that venous blood is just contain the ADTA, which is anticoagulant. So the venous blood should be kept or should be preserved by using anticoagulant known as EDTA, ethylene diamine tetraacetic acid, simply EDTA. So that is anticoagulant which we are using for the purpose of preserve or protect our blood from clotting. So now let us see the safety precaution and procedure with limitation and also quality control of the result, and lastly calculation. So let us see the safety precaution, those precautions that we just do, or we just put in our head in order to make sure that everything is going very well. And also procedures with limitation, procedure of doing this method of haemoglobin cyanide method, and also quality control result, lastly calculation. So by the end of this method, we are supposed to do calculation in order to know the exactly amount of hemoglobin concentration.